Hello, welcome to sqadia.com. Now, if a patient presents with AVN and you have diagnosed with AVN and after staging of the disease, how would you treat that patient? Would you treat a patient who has early AVN or osteonecrosis same as one who has a late osteonecrosis? Definitely not. So the point is that depending upon the stage of the disease, if it's early onset, yes, non-surgical treatments are a good option. But as the disease progresses, for example, if the joint as line has been endangered, there is reduced joint space, or there is acetabular arthritis as well, or there simply such as fragmentation or collapse of the head. Now, if collapsed head cannot be restored anatomically, so then definitely we have to go for some kind of surgical options. So what are the surgical options in case of an established AVN? In this section, we're going through the different types of surgical options. That is the core decompression without grafting, then core decompression with graft, which could be as simple such as autogenous graft, or it could be simply vascularized fibular graft. Then there are different techniques such as hip resurfacing and osteotomies, which may be visible. Then there is options of orthodesis and replacements. Now, as you know, that the theory is basically that it's a closed compartment. If there is an arterial occlusion, this would lead to result in eventually loss of the blood supply, eventually hematoma formation, increase intra-compartmental pressure, leading to venous stasis, and eventually further venous stasis would eventually cause bone marrow edema and sinusoidal compression and eventually osteonecrosis. So all this sequelae is actually due to the increased intracompartmental pressure. Is there a way out that we can reduce this intracompartmental pressure? That is probably by this technique. That this is the core decompression technique. Is actually you take a stymine pin or a reamer, which is of 16 mm, and you use it to core decompress. That you ream it to this level, then this level, and this level. So it's actually this whole area is reamed out. This is the bone which is actually reamed out. So this is the volume of the bone is actually reduced so that the intracompartmental pressure is reduced. Now this bone can either be left as such, this hole in the bone which eventually would heal, as there are definitely the blood is there, and then eventually the inflammatory markers are there, the cytokines, the cells are already there, then they will cause the healing of the bone. The other option is that it can be plugged in with a autogenous bone graft. Now, once the core decompression is done without bone graft, or it can be done with an autogenous bone graft as well. Now, with graft, this is the technique that you drill a hole in, and then you can put in the autogenous bone graft, which is usually from the iliac crest. Then all this bone graft is actually put in. Now, other option is of actually going into the joint. As you know, this is the bone which is the problematic area. This is where the necrosis is. Instead of going through this way, the graft can be put and plugging the hole from this side. It can be done from directly from that side as well. There are basically two different techniques. One is called a trapdoor technique, and another is the light bulb technique. If you see, this is a cartilage hinge. They have opened the joint up and took the cartilage out, and subchondral bone is actually exposed and curetaged out. All the dead bone is actually removed out, and then this area is actually filled with the graft, and the door is actually shut down back, and that's it. But the other technique is, because the problem with this was that this was actually the cartilage was taken out and then it was put back. Eventually it still produced arthritis, because what we want to prevent is eventually the arthritis of the joint, so that the hip remains normal. But not these all techniques are actually early in the osteonecrosis. Eventually, when there is early or intermediate level of osteonecrosis, then there was another technique which is called as light bulb technique. Instead of going into the joint and removing the cartilage and damaging the cartilage, what they did was they made a window in the neck of the femur. Via the neck of the femur, they took the curettage in, took all the dead bone out, put the graft in, and just put it back. This was kind of a light bulb technique. That they created a hole from outside, went in, did the job, and come out in kind of a light bulb way. The next option is vascularized fibular graft. It's very popular. It's kind of a very good option, especially in case of intermediate to osteonecrosis. What is done is actually, this is the area which is necrosed. This is the area which is a problematic area. First, the reaming is being done. After reaming, the actually intracompartmental pressure decreases. All the dead bone is removed actually. Once the dead bone is removed, then with the help of a plastic surgeon, the fibula is taken out. Middle third of the fibula can be taken out along with its blood supply. It's re-anastomosed with the blood supply over here, and this fibula can be plugged into the window which is being created by the reamer. So it actually acts as a vascularized graft or vascularized bone, which can actually induce growth over this area. This is technique for the vascularized fibular graft technique. Now, other options include hip resurfacing. For example, this was somewhat popular initially, but now it's largely been abandoned. The reason is that if the problem is only in the head, for example, head has collapsed, or there is subcondylar fragmentation, then but still the joint space is intact and there is no acetabular arthritis or pelvic arthritis, then probably yes, we can go for hip resurfacing. But the problem with this is kind of surfacing is usually with the mobility, either there's dislocation or there is a lot of problems. So it's not a kind of a option which you can readily use in young patients. Now, if a patient presents to you and there is definitely advanced stages, this hip resurfacing is probably for intermediate to late osteonecrosis. Partial and complete replacement is all for late necrosis. Now the head has collapsed. There was initially fragmentation, head has collapsed, and now there may be joint line may be decreased. There may be some degree of arthritis as well. But if there is no arthritis of the acetabulum and pelvic area, then only the femur head can be replaced in case of partial head replacements. But if the osteonecrosis has actually progressed to such an advanced stage that has not only caused the collapse of the femoral head, there is reduced joint space and there is advanced changes in the arthritis of the acetabulum, then partial replacement is not the choice, because arthritis of the acetabulum will still cause pain despite the replacement. So then the option is the total hip replacement, that is the THR. In this diagram, you can appreciate this bilateral THR being done for the patient, and it's most likely cemented, as this can be seen as well. And this is probably non-cemented bipolar, which is being done on this side, but total hip is done on the right side. If the changes are so advanced that the head has collapsed, the head is not salvageable, joint space is reduced, and there is advanced arthritic changes in the acetabular cartilage as well as acetabulum, then probably the best option is to go for complete replacement, that is the total hip replacement. In this section, we have gone through the different surgical options for avascular necrosis of the femoral head. But remind you, what matters is at what stage the patient has presented. Then we can have a conservative option. But if the patient is presented in the late stage and there are advanced changes, then probably the replacements and surgical options are of better value than going for any kind of a conservative option. There is a plethora of options available depending upon the stage and the clinical judgment of the physician. Any options can be applied. It could be simple as decompression only, or decompression with graft, or decompression with vascularized fibular graft. It could be simply partial replacements, hip resurfacing, or the most commonly and readily employed method, that is the total hip replacement. Thank you very much. Keep watching sqadia.com.